Yes, indeed. Good morning and welcome. This is indeed Power Breakfast right here on Citizen TV, and it's the time when we take a look at the headlines this morning. And to help us do that, we have none other than Jonathan Mweke, Deputy Governor of Nairobi, and Brian Mweke, CEO, Institute for Education in Democracy. Very interesting headlines this morning, and one has to do with Nairobi County, and we're very privileged to have the Deputy Governor with us. And that headline is on the Daily Nation: 20 billion shilling audit shocker for county. And the very interesting line at the top of that headline reads, "Devolution, when it comes to financial mismanagement, Nairobi is in its own league." We'll be discussing that in a short while. The headline on the Standard has to do with education. Secrets of new system as 844 to end. Radical changes are expected in education curriculum as conference to pull curtain on current system sits this week. Now, because I know we will not spend so much time discussing this topic, this particular headline, I think I should just go through some of the highlights. And on the front page of the Standard, I'm reading directly from the paper. Out 844 in 2663. This is the front page of the Standard. No individualized national exams. Continuous assessment tests introduced. No wastage as all children transit to the next class. 3 career paths at secondary, that is arts and sports, social science, and STEM, which stands for science, technology, engineering, and maths. National stakeholders meet this Thursday to ratify that new structure, and piloting is planned for May next year, with the national rollout expected to be done in 2018 on a phased-out approach. Of course, emphasis will be on ICT, indigenous languages, sign language, with options to learn Chinese, German, and Arabic. Of course, the new system that is going to replace 844 will mean that 2 years of pre-primary, 3 years in lower primary, 3 years in upper primary, 3 years in lower secondary, another 3 years in immediately after lower secondary. I guess that will be high school, where you have the option of arts, sports, social sciences, and STEM, and then 3 years in tertiary education and training. Now, that is a proposal that we'll just have to wait and see what happens on Thursday. Remember, it is yet to be approved. It's still as a proposal. We are waiting to see what happens. Another headline to do with education. Still on the Standard, on page 2 of the Standard, and this has to do with KCPE. Remember, last week the KCPE exam results came out on Thursday, and 239,000 candidates to miss Form 1 slots. About 239,000 candidates who set for this year's KCPE will miss Form 1 places. Data seen by the Standard indicates that the available Form 1 spaces in public and private schools is about 713,000. Remember, about 950,000 candidates sat for that exam. The other headline, very interesting headline, still on the Standard. This has to do with education. I'm just going through quickly the education headline so that you can move on with other discussions. Bill outlays pregnancy tests in schools. That's on page 5 of the Standard. Teachers barred from informing parents on pregnancy without permission of affected girl, says draft law. Now, the bill is sponsored by nominated Senator Elizabeth Ongoro and is expected to be introduced in the Senate for debate. It is the first attempt to cushion pregnant teenagers from an unforgiving society that often frowns upon such cases without providing the necessary support to the affected. Mandatory pregnancy tests in schools have often been condemned by human rights activists as callous and a violation of the teenager's dignity. Of course, now this bill, if passed, will ban mandatory pregnancy tests for schools. Wow. Very interesting headline, and I don't know if the panelists have anything to say about that. They don't look like they have anything to say about it. Interesting to see. We'll just have to wait and see what happens. Of course, the other big news, and it's on both front pages of the dailies, has to do with health. Of course, the doctor's strike begins today. It is on the front page of the Daily Nation. And of course, this has a lot to do with the counties, and it's good we have the Deputy Governor with us because health is now a devolved function. And the nurses' strike that has been ongoing for about a few weeks or so has really paralyzed the health services, provision of health services across all government facilities which are run by the county governments. Now the doctor strike will simply shut down services completely starting today. We do understand that the Council of Governors is meeting this morning to try and resolve that matter, but as it stands, no resolution yet. Where do we go from here?
I think the health crisis has been precipitated by the lack of devolving health completely by the national government. You recall that health is a completely devolved function. The national government only remained with a few referral hospitals, which is Kenyatta, Mathare, the spinal injury, and Moi referral in Eldoret. And yet 50% of the entire health budget stays at the center, which means the other 50% goes to the counties to be shared amongst the 47 counties. So I think that's problem number one. The counties are not funded properly to take care of the healthcare. That's why you've been seeing challenges with the doctors and the nurses throughout. Number two, the government came up with a policy that said free maternity. But there's nothing for free. The offices, the hospitals have to operate. Yes. The hospitals have to ensure that our sisters and mothers give birth. And it costs money to do that. So since it was a government policy, what the government said is for every baby that's born, we will pay for it as the government so that it is free to the citizen. The counties hardly receive that money. If they receive it, it comes extremely late. You saw the amount of billions that's owed to the counties from that. There was a report just a few weeks ago. So that again, it shuts down the health sector in the counties. Then the county governments are not able to pay the doctors and the nurses sometimes on time. So that brings a crisis. Number three, you have the problem where the national government, while they should just be dealing with policy and having the counties run healthcare uniquely within the counties, they decide what the counties want. And that's why you saw some of these scandals of mobile clinics in containers, containerized clinics. Yeah, how do you just go from the center and buy containerized clinics for 47 counties? 47 counties are unique. They have unique health needs depending on how many health centers they have per so many kilometers, depending on how vast the counties are, depending on how their hospitals, clinics and health centers are set in. So the governors and the health workers in that county are the ones who decide the priorities of health in that county. And that's why I keep using the word unique. All counties are unique, they're not the same. So the government
is that the reason why there's also complaints of disparities in how these health workers are paid? Because I understand they're also complaining that their salaries are not harmonized. Some people are earning more for the same job.
Yes, I'll come to that because I'm also familiar with that issue. Yeah. So and then also remember the 37-point-something billion shilling medical equipment that was again bought, and the governors were untwisted in signing some of those deals for all those leased equipment for health centers within the counties. Now, were those necessary? In some areas, yes. In some counties, probably not, because some counties don't even have that electricity or don't have internet to be able to transfer images from one hospital in the county to another hospital in another county for the doctors to look at. So it's about prioritization of these health funds. That money that's been used to buy unnecessary things to dictate how healthcare is going to be run in the counties could have been money that should have been given to the governors to decide how to run healthcare in the counties. Then the governors and their health CECs and the health workers in that county can decide what are our priorities and what are we going to do with this money that is being brought for health. Even if there are conditional grants, that would have been fine. But without that and things being decided for the counties from the center, then it's very difficult for the counties to manage something. It's like me giving you something to manage and then meddling in its management completely. Now, about the disparity, this came from when devolution happened. All the health workers were devolved fully. I've said the funds were not devolved fully, but the health workers were devolved fully. But you recall, the city councils, the municipal councils had their own health systems. They had their own clinics, their own hospitals, like Nairobi had Pumwani and so on and so forth. And we used to pay our health workers a little better than the ones that came from the national government. So the national government people were brought completely devolved completely. All the doctors and the nurses from the national government, they were devolved to the counties. And once they were devolved, they found out that their colleagues who were already in the counties then were earning much more and had much more perks, because there was a disparity of allowances, perks and salaries between those two. So they say
they're working in the same facilities now.
Yeah, now they're working in the same facilities. Yeah, so now they say, okay, fine, you need to harmonize us. But the counties sit down and say, okay, fine, you've been devolved, but all your funds have not been devolved. So where do we get the money to harmonize you? And then that causes unrest. Now let's talk just a little bit about this health crisis, and specifically for Nairobi. You know, a few months ago we had an issue with Nairobi. where they are talking about the same issue: salaries not coming on time, we are not being paid some of the parks that we are promised, and so on and so forth. And we sat down with them. We agreed on how we are going to implement those in phases, because everything has to be budgeted for. We got a return to work formula with doctors and nurses in Nairobi, and we all agreed about how that is going to happen. We started implementing. We did their promotions, we did their harmonization. Those who had not been paid, we paid in the August and September salaries, and they returned to work. So I'd be very shocked if today the doctors and the nurses and other health workers in Nairobi go on strike with their national colleagues, because they shouldn't have a problem. We agreed, we harmonized, and we sorted out all their issues.
The fact remains that they're actually going on strike unless a deal is thrashed out within the day. But coming to you, Bwana Weke, of course, this push and pull between the central government and the county government means that patients are the ones who suffer. Do you think it was premature for us to actually devolve health services that soon?
I think the constitution is very clear, and really the question would be how to devolve, because matters health is a preserve of the county governments. So again, the how it was done is where the problem is. You can actually, even when you listen to the deputy governor, you listen to the disparities in terms of pay, you listen to disparities in terms of packs. So for me, moving forward, there is need for the national government, the Salary and Remuneration Commission, and the county governments through the Council of Governors to actually sit down and harmonize all these packs. And of more importance is, again, we need to agree on how to clearly devolve virtually all facets of health function. Because again, the fact that the national government wants to hold on to certain sectors of the health function, to me, again, does not make sense. And that's why we're actually in this crisis. Now look here, the people who signed the CBA were the national government. Now the functions are actually devolved. So it's a very tricky affair. Now, I've seen the health workers are dubbing their strike lipa kama tender. You see, the same way you're paying your fast-tracking tenders is how they want to be paid. And they're raising key concerns. One, the doctor-to-patient ratio in this country is 1 to 16,000. That is quite high. And they're saying they need more doctors to be hired so that we can reduce that doctor-patient ratio.
Yet you are still exporting about half of all the doctors and health workers trained in Kenya.
Absolutely. Yes. Why? Because we're not paying them well. I saw the other time when people spoke ill about Kavura, who was a salonist, and that particular sector came in defense and said, we have saloonists who are being paid way more than doctors, yes, or healthcare workers. So for me, there is need for us to think critically. The amount we are talking about is only 8-point-something billion. What we are seeing being stolen by just one individual is 1.6 billion. The government, both at a national level, Salaries and Remuneration Commission, as well as the Council of Governors, need to sit down and see how best they can be able to harmonize these packs, to see how best they can be able to pay. If we are losing to the tunes of billions through corruption, and that goes into individuals' pockets, then really let's pay our healthcare workers.
And Brian, what you alluded to, I think is also captured on the cartoon on the Daily Nation. That's page 14 of the Daily Nation, where the cartoon has to do with the health crisis, and doctors, they're going to Treasury and with the placards reading "No CBA, no work." And the clerk there behind that cubicle at Treasury says, sorry, everything has been looted. And you can see someone carrying the loot going out whistling, and behind him on his back is written campaigns. Of course, the perception there is that politicians have looted everything seeking to get elected seats at the expense of health systems. And do you think this caricature is valid?
Well, it's not, because really this says treasury, and the health workers need to be paid from the county coffers. And this brings me back again to this thing called devolution. We need to take a good look at what devolution was really supposed to achieve. And I keep using the word unique because I think that was the spirit and the letter of devolution. I think the constitution envisaged devolution to have counties as unique local governments, where they're taking care of unique people in their own unique ways. Now, when you have the SRC come and decide that everybody in the county, in any county, in all counties, must be paid the same amount of money, you're taking away the uniqueness aspect for it, because the rent... Are
you suggesting that a health worker or a doctor working, let's say, in Isiolo County should be paid differently from one working in Nairobi County?
Absolutely, because the standard of livings are different. Why do people go to work and get paid? They go to work and get paid because they have to live, and you get paid according to the standard of living. So in Isiolo, a doctor might have some hardship where he might have to go for very long distances to get to work in very difficult terrain. So their mileage should be more than Nairobi, because Nairobi you cover less distance and you have better roads. A doctor in Isiolo should probably get less house allowance than a doctor in Nairobi, because in Isiolo you'll go buy a nice or live in a nice house, 3-bedroom with a good compound for 15,000 shillings rent. In Nairobi it's 200,000 shillings rent. So why would you want them to be paid the same? Why would you want their allowances to be the same? And that's the uniqueness that we have refused to embrace. And what that does is, if you're putting all the counties to act the same, to look the same, to smell the same, then you're taking away the competitiveness and the creativeness that the governors and the leaders in those counties should have.
But that would also present a problem, Brian, because now all the health workers will want to work in areas where they earn more as opposed to going to those hardship areas.
Now, you see, when we adopted the new constitution, the issues of tax was actually clearly allocated to Salaries and Remuneration Commission. I agree with the Deputy Governor. It is very clear that, and even in public service or in healthcare or regardless of which sector, there are very unique issues in different counties. But we are saying we need to harmonize that so that it is very clear. There is a clear procedure on how that is done. But currently, the way it stands, it's what I would call an organized confusion. So there is no clear thought process that has been put at a centralized level. You see, for instance, the team in Nairobi would negotiate based on what they think ought to happen. Same applies to another county. But that is what we are saying. We need a standardized sort of thinking, so that we agree there are those issues. For instance, somebody living in Nairobi, the cost of living is extremely high, and of course somebody living in Suba, there are very tough conditions that you have to look at. But that has to be done by the Salaries and Remuneration Commission, and it has to be done in a well thought out process, so that again you do not find certain disparities. You find counties that share more or less the same thinking, more or less the same conditions, but still there is serious disparities. You find the least paid doctor earns 37,000. A whole doctor who has gone to school is being paid 37,000.
But then, Brian, that's 37,000 no matter where you are.
So whether in Nairobi,
Bungoma, exactly. So if you're in Turukana and it's 37,000 and your family is in Nairobi, you spend your entire salary just coming home.
Yes.
You see what I mean? If you're in Nairobi, you spend your entire salary just paying rent. So you really have to do it differently.
Transport.
And transport, And I like what Brian said is not well thought out. I've seen one of the things that the doctors are looking for are the perks in mortgages, in car loans and everything. The Salaries and Remunerations Committee went and said, listen, all the counties, all the public servants, everybody must be given a mortgage of this much, everybody must be given a car of this much, and the counties pay for it. Now, was it well thought out? No, because in Nairobi, how do we even implement something like that? We tried, we went and we looked at all our employees, 11,000 something. It came to about 3-4 billion shillings. Now, salaries themselves we are struggling with, because we are getting less money now from the exchequer than when we used to get when we were city council. Now, how does somebody wake up in the morning and say, now Nairobi, find some extra 3 billion from somewhere and give everybody a loan for a mortgage and a car? And how these loans are done is you have to take the exact amount of money, give it to the bank, then the bank administers it. So you must have the money up front. So there are some things that are done that are impossible to implement, and that's when you hear people saying there is a stalemate, because the doctors want something or the workers want something, and it's completely impossible to implement it. But before we go out of the health thing, I mean, devolution of health, you asked, should it have stayed in at the national level? Absolutely not, because I think the very core of any society is healthcare, and healthcare has to be decided in the very lower level, at the lowest level, and here it's the county government level. And I'll show you some of the benefits. When we came into office, we had 85 health centers. Now we have 105. We've more than quadrupled the amount of maternity beds we have. So places like Dandora dispensary now has maternity, Mutuini has maternity, places like Bagathi now has maternity, and you're hearing residents say we used to have mothers die or babies die coming from Kayole going all the way to Kenyatta, but now we can go to Mama Lucy, we can go to Dandora, and so on and so forth. Now there's medicines in the health centers that are doing well. Pumwani is giving birth to 120 babies a day. It's never happened ever before. So some of these things are good because devolution envisioned that health is best managed at the county level, and we've been able to see the benefits in Nairobi.
But of course, there's a stalemate in the health sector, and doctors have vowed that they are going on strike starting today. Of course, it should be noted that nurses in quite a number of counties have been on strike for the last few weeks, and that has meant that many patients have not been attended to at county level and have been for some time now being referred to Kenyatta National Hospital and the Moyo Teaching and Referral Hospital in Eldoret. But as from today, it should be noted that even these facilities will be affected by the strike, because doctors countrywide are going on strike. Now, yesterday at 9:30 p.m., the CS at Cleopa Mailu held a press conference and pleaded with the workers to reconsider their decision. They are yet to respond to that appeal, and we are waiting to see what will happen today. For now, let's take a short break, enjoy some music from Carlos and the band. We will return to discuss matters to do with Nairobi and this shocker on the Daily Nation.